Before we begin, just to recognise the incredible brain capital there is in this room, it's maybe inappropriate, but I think we have a round of applause for all the speakers that have already spoken. I'm just so deeply impressed by everything that we've heard already. So we've now got an expert panel of individuals. Perhaps if you could join us. So we've got 6 experts joining us. Boylan from California Department of Healthcare Services. Brian joins us as a founder of CALMSY. Shaun from the Kansas City Chiefs. Dr. Jayme Banks from the School District of Philadelphia. Monica Bharel from Clinical Specialist from Google. And Dawn Ziegler, a VP of Behavioral Health at Geisinger Institute. We're going to try and demystify some of the places in the next 30 minutes of where to start, where to begin. Perhaps while our speakers are just mounting their chairs, let me know if you need a hand. Let me just set the table. We all know that, as Walt Disney said, our greatest national resource is the minds of our children. And if that is the case, we're in a precarious place right now. Globally, 1 in 7 young people has a diagnosable mental health issue, often going undiagnosed, untreated. Closer to home, I'm sure all of you are familiar with the CDC research that came out earlier this year that really painted a bleak picture over the last decade of the decline in youth mental health. 57% of teenage girls feeling persistently sad or hopeless. 22% of high school students seriously considered suicide in the last year, and 10% attempted it. As Harris mentioned earlier, this not only has huge implications for individuals, their families, and the communities, but a huge impact on the economy. And so the economy of the future, by the end of the decade, poor mental health will cost the global economy $6 trillion. There is some cause for hope. As we've heard earlier, the incredible innovations in California show that governments are investing to put mental health and youth mental health on the level of prevalence and level playing field with physical health. We also know that stigma is being addressed. Every generation feels more open about tackling that. And the promise of technology, both also harm that it may do, but also opportunity that it's got with AI is something we should be looking at. We know that 75% of lifelong mental health issues form in your formative years up to age 25. So there is for us a golden window of opportunity to support the next generation. And that's today what we're going to be talking a little bit about. So we've got experts joining us from education, healthcare systems, sports psychology and technology to explore this topic in the time that we've got. And maybe just to work our way across the room to start off with, ask each of our speakers to introduce themselves, talk about the role that they have for a couple of minutes and why this matters to them.
Thank you so much, Tim. And thank you so much to the Brain Capital Alliance, the Baker Institute, HKS, Kooth, and the Mental Health Services Oversight and Accountability Commission for having us here in this prestigious panel this morning. Happy to be here representing the state of California, Governor Newsom, Dr. Galley, and the Department of Healthcare Services in California, which is the state Medicaid agency, and where I have the pleasure of serving as an executive member of the team directing the Office of Strategic Partnerships, which I think is an important place to start because strategic partnerships are absolutely critical to advancing brain capital within the state of California, but also globally. Thinking about how we reach across different systems that support children and youth is really what our work in California is all about. Dr. Galley spoke about the many investments California is making to advance services and supports across the lifespan. And I will talk a little bit more detail about some of the work we're doing as part of the Children and Youth Behavioral Health Initiative. So as Dr. Galley mentioned, that's a $4.7 billion investment by the state of California and is the cornerstone of Governor Newsom's Master Plan for Kids' Mental Health, which also includes significant investments in education and in the transformation of the Medicaid program in California. The Children and Youth Behavioral Health Initiative, or the CYBHI, represents 20 work streams. It's a multi-department, multi-year package of investments that is focused on many different aspects to support youth mental health and address the mounting youth mental health crisis in California. Some of the things that we're working on are some of those things that Tim just mentioned: a public awareness campaign to address stigma, significant investments in the behavioral health workforce. We are also very focused on supporting social and emotional learning in schools and rethinking how we pay for school-based behavioral health services by requiring partnerships between our commercial insurance plans, our Medi-Cal or Medicaid plans, and our schools. So thinking about how we hold our health systems accountable to serve their members by partnering with schools to deliver care. We are also investing significantly in technology-enabled solutions to be able to meet this moment and provide services to children and youth, where they are. And today, where kids are is on their phones, in their rooms, thinking about their day, their struggles, their relationships with their parents, their relationships with peers. And we want to be able to bring services to them in that moment that they need help. And so in January, we are launching 2 different youth-facing virtual services platforms, applications. They'll provide app-based care, coaching support, educational resources, peer communities, and all moderated by licensed behavioral health professionals and supported by a coaching workforce. We're partnering with Kooth to serve children and youth ages 13 to 25, and partnering with another company called Brightline to serve our youngest children ages 0 to 12, focusing on the development of our youngest Californians in a model that also supports parents and caregivers to give them the supports that they need to be able to assist their children in the development and mental health issues. We are also investing heavily in other digital therapeutics through a partnership with the Child Mind Institute, and thinking about the role of augmented reality and biometrics in the future of services to support clinical outcomes in communities through digital solutions and technologies. So lots of work being done in California. We're going to talk a little bit more about that, but I'll pass it on to my next colleague.
Thank you guys for having me. As Tim mentioned, I'm the lead mental health provider for the Kansas City Chiefs. I do all the mental health and sports psychology work for our football organization. I have met a couple folks in Philadelphia who I know are still upset at us and haven't gotten over the Super Bowl. But I'm extremely grateful to be here, and thanks Kooth for Kooth and other folks for having me. I do this work because back when I was a college football player, I could have used someone, and so that's really kind of the approach that I take. I'm lucky enough to work for an owner and a head coach who really believe in what I do, and they believe it's a competitive advantage that our players have access to myself, and really we focus on their mental health all throughout the year. We kind of take a very strengths-based approach to how we work, and my job is to help support them every single day and help them kind of hopefully perform at a really high level both on and off the field, and that's something that is really important to our organization as a whole. So thank you guys for having me, and I'll pass the baton.
I think I was seated here for a reason, but I won't take that. Hi, everybody. I'm the Deputy Chief of Prevention, Intervention, and Trauma for the Philadelphia School District. And mental health is what I do, who I am, and part of just what is really important to me. Won't go into a long story, but back in my middle school years, a friend came to school with a bag of pills, disappeared from our computer class, came back, and bag was empty. I then watched, I then informed the nurse what I thought what happened, and then I watched her life just kind of spiral. And I said, "No, child, no family, no one should feel that way. And so the rest of my life has been working on that. So I'm responsible for mental health for our students in the Philadelphia School District, over 250 schools. And in my work there, have been working with my team to increase, widen the continuum of services. Everything from the most severe to what appears not to be a problem, but if we start there, that upstream work, we start there, then it will never, hopefully, become a larger problem. So we have been working with our partners to make our partners a part of our community and a part of the work we do, so it seems like a part of the system and connected. Kooth is one of our wonderful partners that we started working with last January-ish. But yeah, we're just trying to increase the services supports for students and families in this time that it's needed so dearly. I'll pass it on.
Thank you. Hello, everyone. Thrilled to be here with you. Thrilled to be talking about this topic. Monica Bharel, Google. The reason that I do this work is my patients, and wherever I've been in whatever system or sector, it's going back to what they need and the focus on the struggles that they've had that makes me think about what our next big step needs to be. I'm a general internal medicine primary care physician by training and over 20 years of practice. I've always worked with individuals in the most marginalized situations, including over a decade in leadership at healthcare for the homeless. I'm a primary care doctor trying to treat people's diabetes and hypertension, but behavioral health issues it was what kept my patients from getting treatment. One of my favorite patients said to me, "Doc, I know what I need to do. People know what they need to do, but I got to get my mind straight first." And the issues related to access, stigma, loneliness went far beyond what individuals were dealing with in the behavioral health and to the greater healthcare system. Then when I was working at a policy level, running our Department of Health in Massachusetts, the work that we did to try and address the opioid epidemic was so jointly aligned with the mental health epidemic of our time and growing awareness related to that. And what we found is, just like we get care in segregated parts of our society, you go here for medical care, you go here for addiction services, you go here for mental health care, our data is stored in that same way, and it keeps individuals like myself who want to understand at a population level who needs our limited resources the most and how do we get them to those individuals and measure impact and outcome. And so we built a public health data warehouse to be able to do that, to understand who is at greatest risk, where are the heat maps showing us we need to go, where do we put our resources, and then measured outcomes. But it goes then beyond health. It's not just healthcare, it's not just health. It's our prison system, it's our education system. It's way beyond just health. So then now my work at Google, what can other sectors do beyond the public sector? At Google, I'm a clinical specialist. I'm embedded in Google Health, which many people may not know. Google has a Google Health group, which is a group of us who are clinical experts, subject matter experts, who work in Google Health products throughout to make sure that health, the voice of health is there and the perspective of health is there. My work related to mental health is in our Mental Health Center of Excellence. And there I focus on public sector and public health work. We think about at Google, information as a determinant of health, right? There's social determinants, there's health determinants, and there's an information determinant. 3 out of every 4 people start their health search in the internet. Dozens of millions of people go to YouTube with mental health questions every day. So how can we be sure that we are elevating the information that is authoritative, trusted, and helpful? And we'll get into how we do that, but one way is a partnership that included WHO and National Academy of Medicine to understand a framework for what is authoritative information, what information will be most helpful when people are looking for help, and how do we raise that up and lift it. And the second is there's data, there's information, and there's personal stories. And working with individuals to raise up personal stories so that as people are dealing with a crisis or looking for interventions, there's hope and inspiration in what they're doing. And we'll talk more about that. But to me, as we work, this is about cross-sector now. The mental health crisis is at such a level. Many of us have been doing this work for a long time, but how do we engage across sectors and look at the levers that each one of us has and pull that lever to say, this is the contribution that I can make. This is what we can do to think about stigma, loneliness, wellness, mental health access, and really work towards new goals and opportunities.
Hi, my name is Dawn Zieger. I'm a Vice President of Behavioral Health at Geisinger. For those of you that aren't familiar with Geisinger, we're primarily a rural setting in central Pennsylvania with a couple urban areas. Why do I do this work? I do this work for the 164 million individuals that are in mental health provider shortage areas. If you think about our youth, 1 in 5 have a mental, behavioral, or emotional issue in a given year, and only half of those seek treatment. So think about the patient that is 50 miles from a provider, and that provider has an incredible wait time. The workforce just does not exist in rural America. So one of the innovations we've done is we've taken folks from population centers and provided care in rural Pennsylvania. We've done this through what many people took as a negative, telehealth. We all had to jump quickly. But we've really seen the opportunity not only to bring workforce to rural communities, but now to start to integrate those providers within the local ecosystem. So we're walking down a path of localizing virtual care so that each provider works within a construct of social services, primary care, hospital systems that they start to get to know. Because the reality is, much as we want to develop a workforce, that's a long path. So we're creating a compelling employment opportunity. One example is with pediatric psychiatrists. For many years, we had 1 pediatric psychiatrist for 24 counties. I now have 13, and I had to say, slow down. We've got to make sure that we can really integrate these folks in a different way. So I'm really excited about this work because I feel like this is a renaissance period for mental health. I feel like it's a time we can iterate on what we know, we can partner in new ways, think about data differently, and I'm glad to be a part of this as a service provider.
Hi, everybody. I'm Dr. Brian Wallace. I'm the Chief Medical Officer and one of the co-founders at COMSI Therapeutics. I'm also the Chief Medical Officer at a company called Neuropositive, and I'll tell you how those two integrate in just a moment. I'm on the front lines right now as I'm creating products for children's mental health. And at COMSI, we create digital therapeutic video games that help children with depression and anxiety. And so each day, a child is given a mission as they go through this video game where they have to help a character within the game overcome certain emotional challenges. And afterwards, they get to engage in real time with an AI-driven video bot that actually talks to them about what did you learn within the game? How have you experienced these types of problems before in your life? And how can you apply that to your own life in order to improve your progress and improve the way that you develop your emotional resilience. So it's a really exciting type of product, and it's a new type of product, but it's also like the next logical step in psychiatry for children because they're spending so much time and so much attention on their screens that we've taken psychiatry and psychology and behavioral health and just put it in an environment that they're comfortable with, that they're familiar with. We use the language that they use, and it really resonates. So they really engage, and that helps to improve outcomes. Now, as a physician, I've worked internationally, and I've seen healthcare systems that are backlogged, that are overburdened. And you see specialist shortages like you were talking about earlier. And it really has an impact on children and their families. And that's why I'm here. I was in the front lines working with children, working with their families, and seeing the struggle that they had as they waited for 8 months just to get a diagnosis. And then you have to wait 1.5 years if you're not going to hurt yourself or if you're not suicidal, just to get your therapy initiated. So you see a deterioration in the child who had initial symptoms of depression or anxiety, and now by the time they go into therapy, it's really become overblown, and it's something that they and their family are having a difficult time to deal with. So I saw digital health as a great way to fill those critical gaps in care, and a great way to really democratize the way we deliver access and the way that children receive these care. So I'm real excited to be in this revolution, as you call it, this renaissance of digital health, and I see a great impact in really improving outcomes as well. So,
Well, we've covered, there's a lot covered there. Oh, sorry. Can you hear me okay? Right. We've covered a lot of ground there already. So I'm just thinking how we dig into a few of these with the time that we've got. I mean, certainly some of the things I heard, talking about taking big steps, a renaissance, redesigning an entire system, through to, scaling out telehealth services to really provide access. Now, in a system often that's really focused on treatment and, who doesn't love a GAD-7, we've got to remember that we're designing systems for humans and children and individuals, and the best kind of outcome is one where someone doesn't need treatment. So I might just ask, we heard earlier about prevention, early intervention, which clearly seems to be an opportunity to move upstream, to take pressure off already pressured services. I perhaps would just like to open it up to the panel to talk about some of the key considerations in organizations as you start doing that. And maybe Autumn, I might ask you, as I know you've got some views on this.
Yeah, thank you so much. I would say some of the key considerations are really around centering youth voices. As you're thinking about designing systems or transforming systems, as one of my colleagues said, youth know what they want. And they'll very clearly tell you if you ask them. So I think part of what we're trying to do in California through the Children and Youth Behavioral Health Initiative is to really focus on bringing youth into the design process, listening to their voices. Over the course of the last 2 years, we've engaged with over 300 youth to help design these digital tools that we are deploying in January. And what they tell us is that they want a safe space where they can come together and share their stories to lift up each other and support each other, and work with, a licensed or really actually not even a licensed behavioral health provider, but with a coach who can be a trusted adult and partner in their life to help guide them through some of the challenges that they're facing. Because while they know what they want, they do need help in figuring out how to get there and achieve the goals that they've set for themselves. So through some of our partnerships with Kooth and Brightline, we're setting up that coaching infrastructure in the digital space to allow youth to be able to access the support that they need, get the help that they need, kind of in that prevention, early intervention space, to be able to focus on the things that keep kids up at night, bullying, relationships, some of the things I talked about earlier. In doing this work and centering the voices of youth, as well as parents and caregivers, because that's also important, one of the things that I try to keep in mind is the voices of my own children who have each struggled with mental health challenges. And it's been a real struggle for our families. So I also try to bring that perspective into the work to understand as a family member or for my children or for many other children in California who don't have parents who are knowledgeable about the behavioral health system or know how to access care. How do we make sure that we can bring these tools to life for those families so that they can get the help that they need, but also connect them from the digital space back into the community for community-based care. And so that's another focus of the work that we're doing, is thinking about how we really set up the infrastructure to allow young people to transition, get the care that they need through the digital app, but also care navigation support to help them navigate a very complicated, and as Dr. Galley said, fragmented healthcare delivery system so that they can have all of their needs met in that whole child, whole person approach. So these are some of the strategies that we're deploying in California, and really trying to think about not just, the kids who access care, but the kids that don't access care typically. And so how do we address for those underprioritized or underserved communities? How do we make sure that what they need and is reflected in the work that we're delivering, and that all Californians can see themselves in the digital spaces that we're creating through our partnerships with Kooth and Brightline. I'll also say that it's really important, and one of the other things we think about is to really address the digital divide. So we're talking about technology today, but there are many children from low-income communities and families that don't have access to a smartphone or to broadband internet. And so as we talk about digital tools to help youth, we really also have to think about partnerships with community-based providers regional centers, libraries, schools, other public spaces where young people can access the digital technologies that we're creating to be able to support youth in California and everywhere.
Brian, we were talking earlier, you're at the intersect of mental health and gaming. Is you want to add any comments to that?
Yeah, I think one of the she touched on it right as she began that answer. One of the things we see is really brilliant solutions, like very scientifically based, have incorporated best clinical practices, but oftentimes those go into a study, they're very effective, they have great outcomes, but then they go into the commercial space and they're just not adopted. And the reason why is because the user experience is really bad. And kids will tell you, like you said, what they want and what they expect. In fact, children are consumers of digital products every day. They're looking at their screens all the time. And they have a level of expectation of what they get in a digital experience. And they expect that with a consumer health experience as well on their device. So we put a lot of emphasis in user experience testing. So we see what things are engaging, or what dialogues are engaging, what types of games they really enjoy playing, what keeps their attention, what allows them to kind of drift their focus away from it. So it's important to do that, but you also have to do it in a responsible way so that they engage, they get to the outcome measures that we require within the game, and then they can move on with their daily activities off the screen.
And I'm just going to riff off of this for a couple more minutes, then
Yeah.
we'll wrap up. What can we learn from sports? What you mentioned, talking about building on strengths. It sounds like we need to focus in a way where we destigmatize and we declinicalize in a way so that we can drive adoption, usage, and uptake. You mentioned talking about building on strengths in your opening few moments. Can you build on that?
Absolutely. I think historically when we've talked about mental health, we've thought about crisis. And, I'm really trying to push our organization, our league as a whole to really kind of focus on mental health every single day of the week. I think, I always say, mental health is on the continuum. Every single day we fall somewhere in between, thriving and healthy and crisis, right? In some way we fall somewhere on that continuum. And I am really pushing our organization and our players to really do the things that they know they need to inch themselves closer and closer to thriving every single day. It's it doesn't take a rocket scientist to know the happier you are, the healthier you are, the better you're going to perform, regardless of what your industry is. Our players are no different, and so I think for us, we really spend a lot of time, they spend a lot of time focusing on the X's and O's and all the strategic stuff that they do. I think the big opportunity that we have in the sports world and really in life is, what are we going to do every single day to make sure that we're happy, we're healthy, we're functioning at a high level. And I always say, success doesn't happen by accident, right? You don't win on Sunday by coincidence. And it's kind of mental health, unfortunately, our mental health is one of the things that we kind of cross our fingers and hope about. We kind of hope that we feel better tomorrow. And I don't believe in taking that cross our fingers approach. I really do think that we've got to be very active in our mental health and managing our mental health. And again, that's something that we really focus on at the Kansas City Chiefs.
Any final comments? I think, Monica, you were talking about big steps. Google's got a huge role in the world already and a future one. What big steps would you recommend everyone here to go and think on? Data being a key one you mentioned.
Yeah, I think, we're using words now, Dawn mentioned revolution, right? Like there is a moment here for those of us who are in this space that we need to capture together. Before COVID, people in telehealth, people would say you can't use telehealth for behavioral health issues. In fact, we had to use telehealth, and when we looked at the outcomes, we saw that equity was mentioned, people who had the least access did better complying with their medications for opioid use disorder when using telehealth. So some of the things that we think we know, we need to challenge, right? We need to challenge and innovate. Google is already using AI for much of the work we do related to mental health. When someone puts in something into search, the query, We use AI to understand, is this person in crisis? 75 different languages analyzed. To understand then, let's elevate for them a crisis hotline. Let's elevate personal storage, knowledge panels with authoritative information, coping modules where they can understand how to speak about the issues that they're having. So how do we use these generative AI processes? We're working with groups, we elevate crisis lines, and then the people, you talked about workforce, the people running those crisis lines, they collapse because everybody all of a sudden needs help. So we're working now, we've created simulators so that you can train volunteers to be able in a much quicker way answer this. So how do we innovate together? Let's use, technology is moving so fast, and how do we bridge that with the mental health work that we need to do? We want to partner with all of you, and I think there's partnerships here expressed by who's on the panel of how we can go cross-sector to really move this forward. It's urgent, and there's no time to stop.
In the interest of time, we could spend another hour just talking about this, I'm sure, but in the interest of time, we'll just pause there. Please give your appreciation to everyone that participated. And I'm sure our experts are around later on if you'd like to talk to them. Thanks very much.